Hello everyone, I am Dr.K.Usha Rani, Senior Consultant Physician, Aster Prime Hospital. This being the dengue season, I am going to speak about a few important facts about dengue fever just to improve the awareness among the public. Dengue is a viral fever. It is not a contagious disease, that is, does not spread by direct contact. It is caused by the bite of a mosquito. Now, when the infected mosquito bites a healthy person, it transmits the disease. It may take anywhere about 3 to 8 days for the onset of the symptoms of dengue after the bite by an infected mosquito. So, the usual common symptoms are fever with high grade fevers, chills, severe headache, and rash. The rash may not be very prominent in dark skinned people. In addition to these common symptoms, patients may have severe joint and body pains, severe low back pain. That's why dengue is also called a breakbone fever. And it can also have severe retroorbital pains. Patients may have mild respiratory symptoms and also loose motions and vomitings. Now, the whole illness of dengue may take anywhere about a week to 2 weeks. Initial phase of dengue is usually the high-grade fevers. Once the fever subsides, most of them present with leakage of the capillaries and drop in their platelet counts, and then comes the phase of recovery. Now, during this period, most of the patients recover pretty asymptomatically. So, when dengue fever affects the person, for the other symptoms of weakness and lack of appetite to improve may take several more weeks. So now, people who are at high risk for dengue are children, especially infants, that is children below the age of 1 year, the elderly people, and those with other comorbid conditions like diabetes, hypertension, underlying malignancies, etc. Pregnant women are also at high risk. If dengue affects a pregnant woman during her pregnancy, it can lead to antepartum and postpartum hemorrhages. It can cause premature delivery, and sometimes if it occurs around term, the dengue fever may also get transmitted vertically to the infant. So the infant may present with symptoms of dengue within 6 to 8 days following the delivery, which may also be associated with requiring some platelet transfusions. Now, dengue, once infected, the person gains immunity to that dengue virus. But remember, there are 4 dengue viruses: dengue virus 1, 2, 3, and 4. So, immunity to one virus does not give immunity to the other viruses. Hence, a person with dengue can have repeated infections of dengue fever. Now, treatment of dengue fever is basically supportive. Plenty of fluids, good hydration is the key to easy recovery. So, good hydration, treat rest, and paracetamol are the main things that any dengue fever patient requires. Other painkillers and aspirin are to be avoided as there may be a chance of bleeding. Dengue, during the first phase, like I said, with the fever and body pains, requires only supportive management. However, the next phase, where there is capillary leakage and drop in the platelets, might require further treatment with or without platelet transfusions. So, dengue can also, though mild, can many times cause fatalities. Dengue can be of 3 types: the classical dengue fever, the hemorrhagic dengue fever, and the dengue shock syndrome. The dengue shock syndrome and the dengue hemorrhagic fevers are the severe forms of dengue which need to be watched for. Now, one can prevent dengue by taking adequate measures like wearing full hands clothes to prevent mosquito bites, using mosquito repellents, sleeping indoors, or using mosquito nets. On a community level, by using mosquito sprays, aerial sprays to kill the mosquitoes would be a good option. And as the mosquito, the Aedes mosquito, which transmits this disease, breathes in stagnant water, any puddles, pools, or pots filled with water, these things must be taken care of and should be avoided during the dengue season. Now, dengue can cause several other complications, like it can affect the lung, the liver, the heart, and rarely the brain too. Hence, dengue, though mild, can sometimes be a severe illness. Any person who has persistent high-grade fevers or has severe persistent vomitings, a severe pain abdomen, or bleeding from the gums, bleeding in the urine, motion, black stool, these people must report to the doctor immediately. Anybody who appears drowsy or becoming more altered in his sensorium must also be brought to the doctor immediately. Hence, I would like to conclude that though dengue could be a mild and insignificant illness, it can also range to a severe fatal illness. Also, it is not easy to differentiate the dengue viral fever from other fevers like malaria, leptospirosis, etc. Hence, anybody with the symptoms that I just mentioned must seek the advice of the doctor at the earliest. Thank you.